Hello on this Thursday, September 3rd, 2009. I'm Kristen Volk with the UPI White House Weekly. President Obama is preparing to address a joint session of Congress next Wednesday in an attempt to regain momentum for his health care plan. His speech comes as opposition builds among lawmakers and Americans, and he's forced to develop a new strategy for striking a deal. The president is aiming to provide medical insurance for 46 million Americans who don't have it, but critics say a public option would only lead to a rationing of care and add to the deficit. Obama is expected to lay out specifics of the plan next week and discuss how it will help Americans with or without health insurance. He also plans to talk about how to pay for the legislation and keep it deficit neutral. And the lack of support over the president's health care plan is reportedly affecting his latest approval rating. A new poll out shows Obama's overall approval number now stands at 53%, which is the lowest point of his presidency. That's down from 76% in early February. The drop is apparently attributed to decreasing support among political independents who gave him an electoral landslide. Besides health care, majorities also disapprove of Obama's handling of the economy, taxes, the federal deficit, and Medicare. He still gets positive remarks for his work in foreign affairs, race relations, terrorism, and Afghanistan. And the president is encouraging all Americans to take, quote, common sense steps in protecting themselves against the H1N1 virus. The virus, also known as swine flu, is expected to return this fall and winter and infect up to 50% of the American population. At a White House press conference this week with Health and Human Services Secretary Kathleen Sebelius and other administration officials, Obama said he doesn't want anyone to be alarmed, but he does want people to be prepared. Among other things, he said people should wash their hands frequently and stay home from work if they're ill. A vaccine against H1N1 is being tested, but health officials say it won't be available until at least mid-October. And that's all for now. Thanks for watching this UPI White House Weekly. We'll see you next week for another one.